My name is Jessica Webb, and I'm doing my geriatric syndrome presentation on sleep disturbances. Sleep disturbance can be defined as any difficulty falling asleep or staying asleep. Some of the most common sleep disorders include insomnias, sleep-related breathing disorders, hypersomnolence, circadian rhythm sleep-wake disorders, sleep-related movement disorders, parasomnias, and other. The CDC reports that 26.3% of adults aged 65 and older report getting less than 7 hours of sleep a day. 42% of people aged 65 years and older complain that they get poor sleep quality. Most affected are women that are widowed, separated, or divorced up to age 85. After age 85, men report sleep disturbance most. The significance to health care includes functional decline. Many chronic health conditions can also cause insomnia. Poor health contributes to poor sleep. Common reasons for a primary care visit for the elderly population, and recognition of risk factors such as polypharmacy, dementia, depression, or anxiety. My patient was a 67-year-old Caucasian female in today with complaining of leg swelling, shortness of breath. The patient reports inability to sleep due to frequent urination and difficulty breathing when she's laying down. The patient is allergic to Biaxin, Cipro, Omnicef, doxycycline, hydrocodone, Celexa, and sulfa drugs. She is currently on the listed medications for her chronic conditions. She also takes over-the-counter medications as aspirin, vitamin D, and vitamin E supplements. All of her immunizations are up to date and current. She enjoys walking around her farm 4 to 5 times a week with her husband. She suffers from COPD, anemia, hypothyroid, hypertension, gastroesophageal reflux disease, and osteoarthritis. The only surgery she's had is a left breast lumpectomy times 3. She's retired from hosiery work. She lives with her husband of 47 years. She has 2 grown children. She did smoke for 20 years, but she stopped in 2008. She denies illicit drug use, and she does drink 4 beers a day. SD presents complaining of swelling in her legs and shortness of breath. She reports feeling this shortness of breath when she lays down at night, and she also has frequent trips to the bathroom during the night due to her medication causing urinary frequency. Some common complaints associated with sleep disturbance include frequent awakenings, difficulty falling asleep, and difficulty staying asleep, daytime fatigue, unwanted daytime napping, irritability, and difficulty concentrating. In review of her systems, the pertinent positives that she reports is the inability to sleep due to her urinary frequency at night and difficulty breathing when laying down. She also reports coughing, wheezing, joint pain and stiffness in the mornings, and the nighttime urinary frequency. Objective data was collected on thorough assessment of the patient. Pertinent negatives include blue discoloration of the external nares. She also had right lower lobe crackles, expiratory bilateral upper wheezes, and auditory expiratory wheezing noted without auscultation. Kyphosis was noted in her upper lumbar region. Lower lumbar spinal tenderness was noted on palpation. She also had pain at her hips, and pain was noted with a hip flexor. Her nails had clubbing, but skin otherwise was negative. Routine labs were collected, all within normal limits. We are still awaiting her chest x-ray results. Her screening tools were conducted with no significant findings. The treatment plan for this patient would be to refer her for a sleep study to rule out sleep apnea. A short term plan would be to add hydrochlorothiazide to decrease the swelling and improve her respiratory effort. Also, would encourage this patient to keep a sleep diary. She needs to be educated on sleep hygiene and natural remedies, such as decreasing caffeine, relaxation, healthy sleep environment, and to decrease stimulation. She should follow up in 1 week to review her sleep diary, assess the swelling, and potentially DC the hydrochlorothiazide, and also assess the need for pharmacological sleep medications. Challenges to this plan would be that the swelling would not be decreased by the hydrochlorothiazide and it would need to become a long-term medication. Another challenge would be that the patient would not adhere to the treatment plan or medications. And the last challenge could potentially be the ineffective natural remedies and need for pharmacological measures. Differentials for this patient could include mood disorder, such as anxiety or depression. This could be ruled out using the Geriatric Depression Scale. Another differential could include substance abuse, which would cause the inability to sleep due to taking a stimulant substance. This could be ruled out by doing a urine toxicology screen. The last differential could include a neurological disorder, such as dementia or delirium. This could be ruled out by doing a mini mental status exam. The final diagnosis for this patient is sleep disturbance due to nocturia related to her medication side effects, and also her orthopnea due to increased fluid retention and a COPD exacerbation. Community resources available for this patient include yoga classes to aid with stress reduction and relaxation, and also home health needed to evaluate for home safety for her frequent nighttime trips to the bathroom. She needs to be evaluated for a fall risk. The multidisciplinary team that manages this patient would include the pulmonologist to evaluate the respiratory status and to do a sleep study to rule out sleep apnea, and also the primary care nurse practitioner who manages medications and her sleep disturbances. Healthy behaviors that were assessed in this patient are frequent exercise or walking around the farm. Negative health behaviors would include the use of the diuretic later in the day, affecting the nocturia. No social determinants were identified for this client. She has great social support from her husband and her children, as well as her church family. Some socioeconomic factors to consider would be her health literacy. Does the patient really understand her diagnosis and the risk factors? Also, does she have money to afford the medications as they are prescribed? Legal or ethical issues faced would be the shortness of breath that could lead to respiratory distress in the patient. Was the patient misdiagnosed? And does she have an increased chance of fall by adding more medications to her already long list of medications? Throughout the research, I learned that there is a definite need for a thorough history and a physical exam. Also, there's definite need for medication review to review interactions and risk factors and side effects from each medication. I also learned about teaching and using non-pharmacological sleep treatment before using pharmacological measures. I was also unaware of the high incidence of sleep disturbance in older adults. The last thing that I really learned was that their home safety needs to be assessed to assess for any falls or potential dangers in their own home. Thank you for viewing my presentation on sleep disturbance.